Hello, little helpers! Welcome to my favorite episode of A Little Help for Our Friends. That's because this is my favorite topic. It is the topic of my master's thesis, which I have been working on the last 2 months. I have just written 40 pages in the last 2.5 weeks on this topic, which is shame, and specifically shame in borderline personality disorder. I find this topic really interesting because shame is kind of like my favorite, least favorite emotion. It really sucks. Nobody likes feeling ashamed. It's painful. I've actually found that it kind of lights up the same areas of actual physical pain in the brain. So we know this is an unpleasant, unwanted emotion. And there's actually debate about whether this emotion is functional at all. This is a debate Kibby and I have had multiple times. But basically, shame is this self-conscious moral emotion, which means that it kind of brings the attention to the self and to how one is being experienced by others, and it influences moral decision making. So what happens when people feel really ashamed is that they unfavorably compare themselves against an idealized other or an idealized personal standard. And, so they find that they fall short. This standard that they're holding themselves to is typically, that's why I say it's idealized, right? It's typically not very realistic. Normally when we go through our lives, we kind of make ourselves blissfully unaware of all of our faults, or at least we try to. We try to kind of go through the world with a generally positive self-esteem. And when we bump up against, knowledge that we're seen the way we're feared that we're seen, then it makes us feel a lot of pain. And it can tend to kind of yank us out of our rational mind, and we start making decisions based off of self-protection. So this tends to be a disorienting, confusing, and irrational emotion. It's also associated with feelings of powerlessness, worthlessness, feeling small, and just wanting to disappear. And a lot of people have theorized that shame and an associated emotion, guilt, arise in different situations and different contexts, but there's not actually a ton of research backing this up. It seems like they can both kind of come from the same general context, like, I embarrassed myself in public, I committed something that goes against my personal morals, other people are going to reject me for this. But the big difference is that when people feel guilt, they tend to be able to say that their behavior was wrong. Oh, I did this bad thing. I don't feel good about that thing that I did. Versus when people feel ashamed, they tend to make this global attribution about the self, like, oh, I'm bad. I'm worthless. I'm defective. There's something wrong with me. Nobody's going to love me. And that's a really different process because it encourages people to do very different things in response. Typically, when people feel guilty, they're focusing on the behavior that they did. And if they do that, their self-esteem basically remains intact. And they believe, okay, I did this bad thing and now I have to repair it. So they'll apologize. They will make reparations. They'll basically confront the thing that happened. But when a person feels this kind of global defectiveness, they tend to feel incapable of making reparations, and the biggest kind of action urge is to hide or withdraw. And so they'll just kind of disappear, or they'll feel like disappearing. You can see people who are ashamed, they can get really slumped. But another big side of shame that's a bit darker is that shame can easily turn into anger very, very quickly. And this happens because when you feel ashamed, it's so painful, and making these judgments about yourself that are so negative is a really awful and unbearable place to be. And so what can happen is that people will push it out. They'll externalize it by blaming the person that made them feel ashamed in the first place, or blaming the, situation or the world, just anything but themselves. And so that they can get angry and in some cases aggressive. And we can see how that's going to lead people into pretty big problems versus feeling guilt can actually fix things. So, Kibby, does this align with, the shame that you've seen in patients?
Yeah, I I wanted to add, because I know that we've gone back and forth. It's been fun, actually, with Jacqueline writing this master's thesis, because there's a lot of late night text messages of debates back and forth about shame and what it is and if it's actually helpful. Like, when we say functional, we sometimes mean helpful in a person's life. At least I try to lean on or emphasize the helpful parts of shame. And I describe it like this to my patients. I say, listen, as we evolved as cavemen, we evolved in our species because we're able to work together, because we have really big, complex, cooperative social networks, right? We're very, like, group-oriented. That's how we survived this long. So humans really have this experience of shame because being rejected from the caveman group would be dangerous, right? If there's something about us that would leave us to be pushed out into the forest all by ourselves, we would probably not survive. So it makes sense that we would have an emotion that would really prevent us from that danger, right? Like making sure people like us, making sure that if there's something characteristically wrong with us, we have terrible hygiene, or we do something bad to other people, or we have these dark thoughts that could be harmful. We want to either hide it away and withdraw and pull it away from the group so we're not rejected. And so, that's the extreme form of how it evolved, but that just makes sense why it's so important for us, even in this modern society, to be accepted, right? There's so much about social support and being connected and belongingness that is important for our mental health. So, trying to prevent being rejected or criticized or ostracized from a group, being liked, being favored, right? Those are all things that we try to go for. So shame is that secret emotion that guides us towards that. I was talking, when I was talking to you, Jacqueline, I was saying that's probably shame is the only emotion that prevents me from walking around in slippers and a bathrobe. If I don't think it's wrong, I don't feel any guilt. I love bathrobes and slippers, but the idea that if I walk into my favorite restaurant in a bathrobe and slippers, people will probably think I'm nuts and kick me out, right? So, It's just at the point in our society where is that really helpful, because we are such a society now of acceptance, right? Especially in America. It's if you have a characteristic that used to be associated with shame or sexual preferences or, like wearing bathrobes, there's going to be a community out there where you'll feel accepted. So we really emphasize not hating ourselves or not assuming that we should hide, withdraw, or change ourselves for the society. So I don't know. I feel like we've evolved to, really have this very useful emotion, but at the same time, I know that it could really, really cause a lot of suffering in people's lives. So it's,
Yeah, it's confusing because, so I would say mainly what we say in clinical psychology is that every emotion has its function, every emotion is useful. June Tangney, who's the major shame researcher, has made the argument that shame is not functional because in pretty much every instant it could be replaced by guilt, which is just more, the effects of guilt actually solve problems, whereas the effects of shame don't. I don't know that I necessarily agree with that. I mean, I don't know, for instance, if I were in a different social group and it just had a really different culture than mine, I'm not sure I would feel guilty for being who I am, but I might feel ashamed in that culture. I think there are contexts where guilt is unlikely to come up. If there's not maybe a behavior that you did that's wrong or that you don't agree with, it's just kind of am I sort of naturally fitting in with this group? So would I be accepted? Linehan, who came up with DBT, which is the treatment we'll talk about a lot this episode, is treatment for BPD, defines shame as something that arises when a characteristic or a behavior of yours is likely to lead to rejection, or when that characteristic or behavior violates a personal held moral or value. And that's interesting. We've had this conversation about should, somebody that's homosexual feel ashamed living in a bigoted culture. And the argument for it is, yes, because it keeps them protected. The argument against it is, I don't really want them to feel shame, like they're not doing something wrong, but it is likely to lead in rejection. And so is shame necessary there, or can you just make kind of like a rational decision to protect yourself? Or is shame the only thing that's going to lead to that decision to protect yourself, to hide and withdraw? I don't know.
It's tough because, it is tough because it's like there really are characteristics, like not just behavior, but characteristics about a person that they're maybe born with or feel like they can't change. They're just like fixing their behavior. Where the society would actually reject them. I think about this a lot when I think of homosexuality and in Chinese cultures in Hong Kong, where my family's from, and I'm sure a lot of others, like a lot of patients I've seen who are homosexual, like came from very religious backgrounds or something, and they just have this internalized shame that's just like bearing away at their soul, and it's really sad. And I think you're right that there's a way that they can unfortunately hide, this part of themselves in that society and stay connected to, or just at least not rejected, right? They can marry a heterosexual spouse and, hide their true sexual preferences without feeling the shame, without feeling the self-hatred that goes along with shame, like I am wrong. But they can, if they have the thought, you know what, I just understand that I should hide this away because the social norms won't allow me to be who I am, which I'm very proud of. So
yeah,
I don't know. I think, there's healthier ways to do that, which doesn't involve a lot of that internal suffering and internal hatred. But at the same time, maybe shame would do that quickly, right? Like instead of, if people aren't like, don't think through those things, the shame might just quickly allow them to hide it without, automatically without even realizing what they're doing. Sad. It's a sad, like, as we're listening, it's probably exactly. Yeah.
So I don't know. I mean, I'll leave it to you all listeners to decide for yourselves whether shame is a useful emotion. I mean, there is this other side of like shame forecasting, and that does seem pretty useful. As you say, like the anticipation of potential shame keeps us from doing bad things a lot of the times, or just things that will lead to mockery, like going to the movie theater in a bathrobe, as Kippy was saying. And so maybe the fear of shame is adaptive. And can that really exist without shame existing? I don't know. It's just a debate. But anyway, the thing is that shame unregulated and chronic and to an extreme leads to some pretty severe consequences. And we'll talk about this episode, how borderline personality disorder has been conceptualized by some people to be essentially a shame disorder and not a personality disorder as we've been thinking of it. And that's a bit of a radical stance. Although I actually think it's kind of an elegant theory. But I will say that Marsha Linehan, again, who invented DBT, doesn't take that stance, but does say that shame, or that BPD is an emotion dysregulation disorder, and that shame might be the most prominent or relevant emotion. So it's not too far off from her.
Right. Yeah, I'd love to. I know this is what you've been writing about these past few weeks. How can we see borderline personality disorder as a shame disorder?
Yeah, so first of all, I'll just briefly kind of go over how chronic shame can develop, and then what we can compare that to what we conceptually think of as the development of BPD. So shame develops in children around the age of 2. This is when the baby is really realizing that they're a separate person from their parents and from everybody else. They learn how to read displeasure in others, and this is also kind of the start of mentalization. So the start of empathy, perspective taking, realizing that other people have thoughts that are different from theirs. And if you think about our sort of sense of identity, our identity is always in relation to others and how people see us. And this is what's beginning to form around the age of 2. And so if you have a caregiver who is really invalidating or who makes you feel ashamed a lot, then your identity is going to start forming in relation to those thoughts. So it's going to be, oh, I'm a person who gets shamed a lot. Oh, I'm a defective person. Oh, I'm worthless, because that's what I'm hearing all the time. And so you develop these early maladaptive schemas of, I'm defective, I'm unlovable, there's something, wrong here. And then yeah, this leads to a real fear of those feelings coming up or those schemas being validated, and also almost like an attraction to those schemas being validated because it's what's understood. Then that turns into chronic shame. And when we think about BPD, Marsha Linehan's theory is basically that kid is born, so this baby comes out, and it's got a set of tools, like a set of instincts for how to get its needs from the environment. So basically that means from mom and dad. These are kind of emotional instincts. They cry when they're hungry or hurt or scared or lonely. They are affectionate, giggly, sweet, when they want affiliation. And what happens is that this kid temperamentally might have a kind of sensitivity to emotion. So the kid comes out and they might scream a little bit louder than other kids. They might get more easily kind of hurt or mad. They might throw up, some more temper tantrums. And this is met by parents who really don't know how to deal with this. And that might be parents who are young and experienced. They just don't know what to do in the face of big temper tantrums and show of emotions. Or this could be parents who are actively abusive. And we know that BPD very often comes along with abusive caregiving environments, and sexual abuse is highly overrepresented in this population. An abuse and sexual abuse, are incredibly shaming experiences. They say to that kid, you don't matter, you're something that deserves to be used by other people, used for their gratification. It's okay to hurt you. And then, this invalidation that happens, this kid might be crying because they've just fallen down and gotten a boo-boo, and their parents say, oh, come on, quit crying. Grow up. Big boys don't cry. And so they're told, oh, okay, that emotion I just, had is not right for the situation. It's not okay. If they bring, a 90% on a math test home, and their mom says, if you were smart, you'd get an A plus, then they say, oh, okay, this feeling of pride I had, that wasn't justified either. And so all of these feelings they have get basically told, no, that's not right. That's not the right feeling to have. You're not experiencing yourself or the world or other people the right way. And so they get massively confused. And this whole identity, see, this is familiar now to the way that chronic shame develops. This identity gets formed around, I don't know what I'm doing here. Something's wrong with me. Nobody loves me. I'm defective. And it goes from there.
Yeah, it just reminds me of not just in BPD, but a lot of people, a lot of patients will talk about this, where if they have any kind of rejection for their emotions or the things they do, and they just, little kids are just so quick to blame themselves, right? They're not going to really have the complex thinking of like, oh, the thing I did was bad, and mommy has her own issues, right? They just think, oh, I'm bad. I'm a bad person. My emotions are wrong. I shouldn't ask for what I need ever again. The end. Right? So I could see how that could become a disorder like that. Yeah.
What happens is that these kids don't have consistent love and support. And so they'll do anything to get it. Mm-hmm. But their ways of getting it, haven't been sort of securely developed because they haven't been interacting in an effective way, or they haven't been interacting with an effective partner. And so they'll do a couple of things. One is if their emotions are often like ignored or invalidated, what can happen is that they'll ramp them up to an extreme. Mm-hmm. So they'll throw like, okay, mom or dad, they don't listen to me when I cry. They tell me to shut up when I cry. But what about when I like fucking scream like a banshee and like throw World War III level temper tantrum? Oh, now they pay attention to me because I'm pretty hard to ignore. What if I refuse to eat for 5 days? What if I just refuse to get out of bed? So over time they get really reinforced for the biggest, most extreme shows of emotion they can. And then that's a language they learn. If I scream loud enough, they'll hear me. If I hurt myself, they'll hear me.
Yeah.
And another thing that can happen is that they will do anything to affiliate. So they'll say to themselves, okay, the way to get love is to never piss anybody off ever, and to be everything that they could possibly want me to be. And so that's what I'm going to do. I'm not going to allow them to see the real me. I'm not going to tell them what my needs are, because my needs don't matter to other people. So I'm going to shut those down, and I'm just going to be what they like. I'm going to be what they like to look like, you know, what they like to talk to. I'm not going to, I'm not going to be unattractive to them in any way. This is both, you know, romantically and with friendships and family. And that is just unsustainable. And it inevitably leads to crisis, because, you know, the person that they're in relationship with now learns to idealize them, or the way that they feel. This is a big thing that can happen with people with BPD and people with NPD, is the person with BPD is very good at idealizing the partner, and then the narcissist loves being idealized, right? And so they're like very happy to be in this, and then they get stuck, they can get glommed on. And the narcissist is just sort of bleeding the person with BPD, but they're kind of doing it unwittingly in the beginning, because the person with BPD like isn't necessarily expressing needs or wants. They're in this kind of strange dance, and then that's unsustainable for the person with BPD, who eventually is going to get asphyxiated by this relationship, because they're not getting anything, they're not getting anything real. And then the narcissist gets criticized, there's a temper tantrum, there's some kind of break, and then it's just this like explosion.
Well, that also explains why people with BPD traits, or even just shame in general, like, are super people pleasers, right? Like, a lot of therapists and a lot of social workers will have, you know, BPD traits, or like, you know, maybe not in the full blown disorder, but that they learn, oh, something about me is wrong, but people really like me if I'm very helpful, right? So I'm going to do all the things, and I do hear that when people date someone with BPD, it just feels so good, because that person's probably a chameleon and figure out a way to be like the perfect partner, and to give into all your needs and be helpful, because they feel so much shame that they're like, this is the way that I know how to get people to like me, not for being myself, but for doing whatever you want.
Yeah, and then we hear about identity disturbance, and people with BPD often changing their appearance, changing their values, religion even. And that dovetails nicely with what's happening here, right? Because they pick up the identity of what somebody else wants them to be. And then, well, what if there's more than one single person in their life? Now they're doing it with everybody, and so that identity is fully shifting according to each relationship. And then when relationships end, you know, then they start affiliating with somebody else and picking up sort of those pieces of an identity. So you combine that with these early maladaptive schemas of I'm worthless and defective, and nothing I do matters or makes sense, and it's just pure chaos and confusion.
Yeah, no, it's interesting to think about, because this is, you know, when we talk about BPD, a lot of it is like extreme dysregulated shame. And, you know, I'm just thinking, as you're talking, I'm thinking about, you know, when shame is not helpful, not only in BPD patients, but like a lot of people, like, for example, some of the typical responses to shame that are not that helpful, it could be like, avoiding thinking about your transgression, or like shutting down or blocking emotion. So that happens a lot in treatment, where, you know, you as a therapist, or even just, you know, maybe in relationships, you might tell your partner or patient like, hey, you're late a lot, or like, what's going on there? And then some people, what we call it is collapsing into shame, where it's just like, you're right, I'm the worst, you hate me, and then shame just takes over. And what that actually does is it doesn't allow them to sit there and get the feedback and change their behavior. They just shut down, and then it makes the other person have to lean in with reassurance. No, you're great.
Yep.
Yeah, and then so sometimes shame could be not so helpful, because it just blocks any kind of repair and growth in that way.
It also prevents them from being honest sometimes with a therapist. And so they might be having a lot of behaviors that are not being addressed because the therapist doesn't know about them because they're afraid of experiencing shame. So it's hugely interfering, but also critically important. There's a theorist named Nathanson who has what he calls the compass of shame model. And this basically says that there are 4 different types of responses to shame. And those are withdrawal, avoidance, attack self, and attack other. And he conceptualizes the symptoms of BPD to just basically be different responses to this compass of shame. So, for instance, the avoidance piece, you're trying to avoid shame, to avoid the feelings at any cost, that's where impulsivity is coming in. So, I don't want to experience shame, I don't want to feel it, and so I'm going to do anything I can to distract myself. And I love these psychodynamic theorists because they just say the most interesting things. He was saying, like, they might have a lot of sex because that replaces the unlovable, shamed image of the self with suddenly a loved image of the self. Oh, somebody, that wants to be touched, that wants to be at least physically loved. They might go on spending sprees because it replaces the defective shame self with an image that deserves gifts and presents. And so just these sort of attempts to push away what they don't want to see and distract with these big avoidance techniques like drugs and alcohol and spending sprees, etc.
Yeah, and I also see how the attacking, blaming others, really popular and common in BPD, but also in a lot of other people where if they feel hurt, they feel rejected. I just worked with someone on this in therapy. Then they find ways to defend against the feelings of shame by blaming someone else, right? And being like, well, they don't know what they're talking about. They're a jerk. Actually, I only did what I did because they did what they did, and it's their fault, right? So it's just like putting the problem into other people.
Yeah, we know that BPD, one of the symptoms is intense anger, emotion dysregulation generally, but this anger can really cause interpersonal problems. Nobody likes being attacked. Nobody, likes it when people are angry with them. And so, yeah, that's exactly what that is, the attacked other script. Then, of course, the attack self script is fairly obvious. That's self-harm. So the shame is basically accepted inward. It's not being pushed outward, and it's taken out on the self through self-harm or through kind of intense bullying and criticism of the self. We do know that the second biggest cause of self-harm is a desire to punish the self. So that's pretty in line with shame. Also could be in line with guilt, though. And the research around NSSI, which is non-suicidal self-harm, and shame mostly shows that it's a response to shame, or that shame is very, very involved. But there's also been studies that show that it's guilt that is implicated here as well. The withdrawal end of the compass is, so dissociation is an example of this, withdrawing so far away from the shame that they actually withdraw out of kind of normal consciousness. Chronic feelings of emptiness, just kind of withdrawing from the self and from feeling at all. And so, yeah, I mean, it's kind of a parsimonious explanation that every symptom can come back to this process. Yeah. The shame process.
I'll give an example of maybe all of that, like a combination of those, and to kind of really highlight what shame could look like in the extreme examples, especially people with BPD. So I think I've talked about this person before. I'm encountering a lot of this recently in my life and clinically and in other domains. But I mentioned I dated a person who, it kind of really fit all the things that we just said, was people pleaser, a helper, and care. He's in the mental health field. So it's just like a really excellent provider in that way. But he had a lot of shame. He really struggled with shame a lot. And especially around a previous relationship with a girlfriend that he just said he hated. He was like, it brought out the worst in me. We were not good together. He would always say, I'm so embarrassed that I was with her. Like when he said, I look back and I'm so embarrassed. And as we were dating, we didn't date very long, but as we were dating, he was saying that she was reaching out, but he was just so embarrassed that she she was causing problems and was denying a lot of, like, oh yeah, but I'm not seeing her or whatever. And then he admitted to me that she said that she's pregnant with his child, and he didn't know what to do. And in the moment, he was just like, she is terrible. You're amazing. And I definitely don't want to be with her. I don't want to be with her at all. And then he disappeared. He ghosted. And turned out that he was just got back together with her. He told me he didn't want to tell me about her and his involvement with her because he felt so ashamed and thought that I would just, really disapprove of him or look down on him for being involved with her. Mm-hmm. Now, of course, there's a whole thing about how, I was dating him, so of course I look down on someone or like reject someone who's dating someone who's like dating someone behind my back, right? But he had so much shame around his relationship with this woman that he couldn't admit to himself that he had conflicting feelings. He was drawn to her and also hated her. And so what happened was there was a lot of dissociative experiences, like he just didn't, or hiding, like he just denied a lot of stuff and didn't remember talking to her, but also pushed a lot of the criticism that he had inside onto me. Right? Afterwards, he was like, you would reject me for being drawn to her. You would reject me for my relationship with her. That's why I didn't say anything about it. Mm-hmm. And I was just like, man, this is everything I've learned in transference-focused psychotherapy and this kind of psychotherapy that deals with extreme shame, where it's like, if you have so much shame about yourself, you might hate a part of yourself deeply, right? Mm-hmm. And then you take that part and you just cut it out inside your mind. It's like, it's not part of you. You deny it. You forget it's there and you push it onto someone else. Yeah. How that looks in therapy is that someone might come in and grew up with a very critical father, let's say, and hated that person. And then she comes in, let's say a patient comes in and then talks to a therapist and say, you're criticizing me. You're judging me right now. I know it. I don't deserve this. And the TFP therapist will have to say, well, it looks like you're seeing that in me. And it seems like that's something that you're carrying around with you. So the patient doesn't want to admit that she is, like, a part of her is that critical father, probably criticizes herself all the time, but doesn't want her critical father's voice to be in her. So she pushes it onto other people. And that's the kind of the blaming part, right?
Yeah. I feel like BPD could be a shame disorder, but I also feel like NPD, so narcissistic personality disorder, could be a shame disorder. And that one actually seems even more like a compelling case. Because we know that, the origins of narcissism typically is also some sort of abuse or like an overly fawning parent who kind of pedestals the child. And so the child is kind of inoculated from like experiencing normal feedback that allows them to have a fully integrated personality. And then it's this shameful, defective self that is fortressed behind this kind of constructed personality where the shame is severed off and kind of kept. And that sounds like a lot like that guy.
Yeah, definitely. I think with the extreme shame is like hating a part of yourself and not being able to integrate the parts of yourself you don't like and do like, right? That's what a healthy personality is supposed to be. You're like, well, I'm proud of this parts of me, but I'm not so proud of these other ones, but that's all me. And some people with so much shame, and they think that I'm going to be unloved or kicked out of the caveman group if I have this critical father part, or I really am drawn to this ex-girlfriend who's really terrible for me, they just really don't want that to be a part of them, and they just cut it off from the way they see themselves.
Yeah, I think that's important to highlight is that, right, when healthy people experience shame, it's like painful and it sucks, but ultimately there's a healthy self-esteem that can kind of cushion that fall from grace. And it can be integrated. Okay, yes, I have flaws, but I also am generally proud of who I am. When you have these schemas that are so global and poisonous, like I am an inherently bad or worthless person, then it's literally an existential threat when you are reminded of that through being shamed, through criticism. It's like, oh my God, people can see this part of me that isn't lovable, that's going to be thrown out of society or from, my social group. It's enormously scary, and so people will go to extremes, self-conscious or subconsciously, in order to protect themselves from it. And those extremes can wind up really hurting other people.
Yep.
And causing a lot of destruction. So the research, basically, I could talk about like what the research has corroborated in these theories. Basically, we know that BPD is highly related to shame, and it is uniquely related to shame. So a lot of these studies have had clinical control groups, which means that they weren't just compared to healthy controls, but they were controlled to groups like PTSD or depression or social anxiety. And shame is more uniquely predictive of BPD than it is of any other disorder. Although I don't know that it has been clinically compared to narcissism. I haven't seen that study done. We know that, again, self-harm is highly related to shame. Actually, a couple of different studies found that self-harm can be done in response to shame, but the interesting thing is that it doesn't seem to actually decrease shame. Shame can increase after this experience. And normally, you would think that a strategy that doesn't work would not be continued. But in this case, the reaction to shame has become so specific and rigid that they just keep doing it. So they feel shame, they cut, that doesn't help. They feel more shame, so they cut again. That doesn't help. Shame rises, they cut again, because self-punishment and criticism and taking it out on themselves is the only script they have. And so there's been research showing that for some people, the shame does go down, and those people are actually less likely to self-harm in the future. And so I just found that like really paradoxical and interesting. Yeah. We know it's related to anger. Many studies have corroborated this. They've found that shame basically can lead to anger, which can lead to anger rumination, which then can lead to aggression. So this link between shame and aggression is still a bit tenuous, but it's looking pretty likely. And that again, that is shame comes, they can't stand it, they externalize it, now they're angry with other people, and they can take that out with aggression. And that might be higher, if the person, for instance, has impulsivity, if they just really can't slow their emotions down long enough to respond to them effectively. We know that BPD is associated with bodily shame, so shame about how one looks or kind of intimate experiences with others. And it's also uniquely associated with existential shame. So this is just shame about the global self. It's associated with all sorts of different, so like cognitive shame is another one, shame like in reaction to a rejection, that's high in BPD, but it's also high in something like social anxiety disorder. Existential and bodily shame seems to be particularly related to BPD. And that makes sense with the high rates of sexual abuse and these early schemas.
Interesting. So is it kind of like an eating disorder thing where they feel like shame, or is it just about your body and sexuality and things like that?
Yeah.
Just in general. Interesting.
Yeah.
Okay. Cool.
Yeah.
And I wonder if this all explains the emptiness. That emptiness, chronic feelings of emptiness, is actually a trait of BPD, right? And it's interesting how people describe that in therapy. People who are depressed say like they're empty, they don't feel a purpose in life, like everything just feels blah. Like that kind of emptiness kind of feels like more of like a disinterest, right? A lack of motivation. Emptiness with BPD is just like, I am empty. Like I'm like a ghost. I'm like a void myself. There's no me-ness. I don't have a self. I don't have like an I. And it just feels so disturbing. And so like, I don't know, my heart goes out to them when I hear that. It just feels so painful to not to feel like a ghost, right?
Yeah, I haven't found any studies on emptiness, but I think one big thing here is that is so associated, I would think, with identity disturbance. And when we think about BPD, it's usually these like three major facets of the disorder. So emotion dysregulation, interpersonal problems, dysfunction, and identity disturbance, which means they just don't have a coherent sense of self. They don't know who they are. It's very confusing. And I mean, we've been talking about how shame can lead to that confused sense of self. But the problem is that the identity disturbance research is really sparse. There's no good measurement of it. And I think that probably is the case with emptiness. So yeah, so there's this big chunk of this theory. I mean, the theory is really, I would say, like pretty dependent on this identity part, and we just don't have any research on identity in the first place. So it's really hard to know. Yeah.
Cool stuff. Well, thank you for giving a little rundown of all your master's work. Now I feel like I have a good idea of the research out there, and a nice little summary. Thank you.
Yeah, we can talk about treatment a bit. I know, so you've done DBT, and there's not a whole lot of treatment for shame. I found one intervention that was transdiagnostic to kind of bring down shame, but the major kind of like sort of pointed intervention is opposite action from DBT. So do you want to explain that? And we've already talked about it on other episodes, but
yeah. And if you're thinking of a loved one that is just consumed by shame, is like plagued by shame, or yourself, you could take little tips from this, the little treatments, or send them to DBT. I would say that this is just clinically and anecdotally. This is just like our experience working with patients with a lot of shame. Reassurance seems like the way to go. I feel like for loved ones and therapists, that seems like the knee-jerk reaction is to be like, no, you're great. You're amazing. Don't worry. You have nothing to be ashamed of. It might soothe the feelings in the moment, but over time, I don't think that I personally haven't seen that make major changes, unless it really gives across, like I really have a strong relationship and it gives across, like, I really see you as like a lovable person, and they may be able to like really take that in. So, but in the moment, I think just reassurance and telling them they're great doesn't really fix the shame. But in DBT, what we do is opposite action, as you mentioned. This skill is very simple. We talked about it in other episodes, but it's basically, if you feel a lot of shame, and doesn't fit the situation, right? You feel a lot of shame, but you wouldn't really get rejected from a group, or wouldn't really get criticized, is to act opposite of what shame wants you to do. So as you mentioned, shame wants you to hide, avoid, lie, blame other people, right? Cover it up, socially isolate. Opposite action is the opposite of those things. It's looking people in the eye, proud, open body posture, talking about the quality or the feelings or whatever that you feel ashamed of in a very proud way, and not hiding, but really socially engaging. And over time, basically, you hopefully learn through doing that you're not rejected, right? Like, so a lot of people say, oh, if I show people my real feelings or come out of a closet, like, I'll get rejected. But over time, when they practice opposite action and they see that they're not rejected, it's supposed to lower shame over time, right? And they actually do this a lot in other kind of treatments without even realizing it. Even just in therapy, sitting and talking about parts of you or feelings you feel ashamed of is opposite action. Or Alcoholics Anonymous, or any of those kind of groups where you stand up and say, hello, my name is Kibby McMahon and I am blah, right? That's the opposite of what, alcoholics would want to do, which is to hide and feel ashamed from themselves, but still drink in secret. So yeah, just opposite action, just like, just look proud and face it and scream it out to the world.
Yeah, that's basically it. So the way basically you start is you do a functional analysis, which is you're trying to figure out, like, where is shame coming up and how are you responding to it? And that gives you points of intervention for where you can act opposite. At some point, you also want to determine whether this shame is justified or unjustified. So Kibby was giving an example of what you would do if the shame is unjustified. You're just feeling ashamed, but maybe you didn't actually do anything wrong. Or maybe, like, you wouldn't really be rejected if people knew this about you. But sometimes you do shitty things, and maybe feeling shame is appropriate. And in these cases, the therapist actually has to be pretty disclosive with the patient and say things like, you know what, I'm really glad you told me about this. I think if I'm being honest, that would make me ashamed too. Let's do some problem solving so we can figure out, how to fix this problem. And in that case, you don't want to keep the shame up at 100%. You want to bring it down to a level where you can effectively problem solve. And the interesting thing about opposite action here is that you're still doing the things that your shame is telling you not to do, but they're different than just standing up straight and smiling and going forth and telling people. In this case, you want to make reparations instead of hiding. You might confess instead of keeping things a secret. You might basically, if you're blaming the other person, getting mad at them, you need to take responsibility. And all of these are actually the action tendencies of guilt. So you could say that when the shame is justified, the opposite action is basically transforming shame into guilt, or at least the way you would act from a place of guilt. So there again is kind of this debate of like, is shame functional if it can be effectively turned into guilt? And that's the only way to get this problem solving done. Again, I don't know. But I do think that's kind of a cool little tidbit of that. I found another sort of CBT intervention. It's very similar. It uses DBT skills actually as well. And it basically involves a lot of psychoeducation about shame and about guilt. And also just a lot of psychoeducation about like cognitive traps. So that's something we talked about in our cognition episode. So like, are we thinking in these shameful ways that are a bit too global, a bit too of a negative like attributional style? And then helping them kind of use CBT skills to stop, also to be much more disclosive with others, and also to kind of write out the things you're proud of in yourself. And you do this in a group therapy format, so everybody's helping each other. And there's actually theories involved here that empathy is really protective against shame. If you can be empathic with others, then hopefully you can be empathic with yourself, and realize that people are multifaceted. But I'm going to kick it over to Kibby because there are a couple other therapies that I think could be useful here. We just don't have the treatment for it. But if we're thinking about shame and BPD as these like early maladaptive schemas, then what better therapy than schema-focused psychotherapy?
Yeah.
So Kibby, can you talk about that?
Schema therapy is very cool. It's a cognitive therapy, and it's a little bit less well known, but I love it because sometimes with these skills that we're talking about here, they do work in the moment, right? They help people feel less shame, and it works on their behaviors. But sometimes when you're dealing with like these really rooted schemas, like these ideas and beliefs about yourself that are rooted in childhood, that can be really hard to work with because you can, I feel like the patient's like, yeah, okay, I gotta find ways to act like less shameful and feel less embarrassed. But sometimes just like the deeper beliefs about yourself are really hard to change. Mm-hmm. Like people say like, okay, I know that people will accept me, but I still feel really unlovable, right? And schema therapy is really helpful for that. Basically, there's all different kinds of schemas based on unmet needs from our childhood, right? And what we're talking about here with shame, there's the defectiveness shame schema, which comes from when you grow up in a family where you're being really rejected all the time. Kind of like the one you just described, when you get criticized for your feelings, your family rejects you for who you are, or like, just your personality, right? And so you grow up with this idea of I'm unlovable, I'm wrong, I'm broken. And cognitive schema therapy will use cognitive strategies. Like one is testing the validity of the schema, like even just saying, is this true? Like in your life, like are you really unlovable? What are the evidence for and against it, right? And then you really want to look at how the patient is reacting to that schema, right? Are they criticizing other people? Are they hiding? Are they giving into it by just having really critical friends and being rejected all the time? Like, how are they actually reacting to that belief that I'm unlovable and I'm something to be ashamed of? And you look at whether that's helpful or not helpful, right? It's like, is it really helpful when you blame other people all the time?
Yeah.
Like, how's that working in your life? Do you want to change anything about it? And figuring out a different coping strategy. And the really special part about schema therapy that I love is that sometimes I do imagery work where you go back and like, you know, it's very experiential. You close your eyes or you kind of work with these memories of when this schema started to form, right? Like you picture a time when your parents told you that, you know, what's wrong with you? Why are you like this? And then you really talk through with the therapist, like picturing this moment, that memory. And the therapist will do all sorts of cool things to it. Sometimes they'll really encourage a patient to like pretend they're parenting themselves in that moment and like soothe them, the childhood sense of self, or at least develop this other view of that old memory that's just like, oh, you know, my poor childhood version of me, I would have like hugged her and told her that she's not broken and she's a lovable little child, right? So you're trying to use those memories first to access like those deep, deep feelings, and to bring awareness to them and a lot of softness and empathy around them, but also to try to develop like this healthy parenting voice in there. Like, yes, I was taught that I was broken and a bad child and a bad person, but I'm going to add another voice inside my head that's loving towards that childhood self. So I think, you know, that's just fun. It's just like this experiential working with those old memories and working on that, like, almost like, yeah, that like vulnerable childlike side of yours.
I really wish they would do studies with schema focused therapy and shame specifically. I think it's kind of a natural fit, but I also like DBT is incredibly effective, and she obviously is paying a lot of attention to the role of shame. So yeah, I mean, if this resonates, I would check out DBT, and I would be really honest about kind of where shame is showing up, because I think this can be a wildly overlooked emotion for whatever reason. And if you feel like you have a friend or a loved one that is experiencing a lot of shame, as Kibby said, I mean, excessive reassurance might not be super effective, but I think maybe helping that person focus on the behavior instead of what a bad person they are can be helpful, and allowing them to actually talk about it, again, as KB said, can bring down these feelings of shame. It can kind of put it in a more realistic context when you say it out loud than when you're just spinning out in your own head. And hearing another person or watching another person listen to this and like not leave you and have a pretty reasonable response to it also can kind of help ground you in reality a little bit. But yeah, I mean, focus on like, okay, I feel like you're spinning out, but actually there's a lot of ways to solve this problem. Like, it sounds like maybe just an apology or, making reparations of some kind. I think you're a wonderful person. I don't think that the shame means that what happened means anything about you other than like there's a problem to solve.
Also with patients, and you could do this with your loved one too, if someone is really spinning out in shame, is to validate, you know, where the shame is coming from. And I phrase it like this: it makes so much sense that you care so much about being liked by these people, or it makes so much sense that you want to be accepted and you want to be praised and for your good work, or if you're of course you want to, you know, go out on a date and be accepted by that person, and like really validate the need for belonging and the need for acceptance from whatever context they're in that's causing the shame, right? So just really highlighting that, okay, you really care about this. What's the best way to do that right now?
Yeah. I also think if you find yourself in one of those push-pull relationships where it's heavy idealism and then everything falls apart and there's fights, I don't know. I'm just kind of tooling with this idea of, I have a lot of patients who just don't bring their wants and needs to the forefront because they're afraid of rejection, or they're afraid that their needs don't matter. So I wonder if you're in one of these relationships, if you can sort of step back and look at like, what pattern are we in? Are there needs that are being unmet here, and maybe they're not communicating this with me, but I get so lost in being idealized and feeling like loved, and then all of a sudden I'm like completely blindsided by a huge argument. Like, is there something kind of going on in the background that I don't see? Am I ruling this relationship in a way? Like, are we always doing the things I want to do? Is she constantly, or he, feeling rejected by me? I don't know. I just feel like there's some room in there to look for where shame might be at play, and if there's like an over affiliation going on that is unsustainable. But maybe that's too up in the clouds. I don't know.
Very cool.
Okay, so in terms of resources, I would say one of the best books on shame has a very straightforward title. It's called Shame and Guilt, and it is by June Tangney, and the other author's last name is Deering. It was written in 2002, but it really goes into what shame is, the theory, and then it's kind of an academic book. I mean, it has like measurements on shame, but I thought it was really illuminating. And June Tangney is like the queen of shame research, so I'd recommend anything by her. Okay, cool. Well, again, as always, if you kids want to turn your shame about not leaving reviews and ratings on Apple Podcasts into a guilt response instead, where you decide to, repair this mistake by leaving us a review, feel free to do so. Thanks for letting me nerd out on my master's thesis, and we will see you all again next week. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.